Dr. Cory Reddish has been a practicing licensed naturopathic doctor since 1998 and is a purveyor of all things good, healthy, and fun. She is the director of the Feel Better HQ, a naturopathic health boutique. Cory in Venice offers naturopathic consultations, high-quality supplements, vitamin injections, nutrient IVs, and functional testing. She is currently focused on keeping people healthy and out of hospital during this time of COVID-19 through consultation, IV, and injection therapy and testing. Now, I didn't pronounce one of those words right, did I?
The apothecary?
That one.
I'm not sure what word, but it sounded good to me. It sounded good to me.
Good.
Yeah.
So thank you again.
Thanks for having me.
Can you talk us through some of what you're experiencing right now with IVs?
Well, here's what I'd like to say about the nutrient IVs and the vitamin C IVs is that there was some research coming out of China pretty early on that was translated from the Chinese hospital, from Mandarin, about a doctor who was using IV vitamin C with his patients. And they were moderate and severe cases. And the thing that's interesting about this illness is that a moderate case, like double pneumonia, is considered a moderate case. Like these are really, really sick people. And he had been using IV vitamin C to treat sepsis, so systemic infections in people, and especially respiratory infections. And from the past, he had known he was getting good results with it. So he used it with these COVID patients. And what they saw was none of them died. They got out of the hospital about 3 to 5 days sooner, which is impressive in this time when the hospitals are overrun and there's, this is different in different parts of the country, but we were concerned about, or the world I should speak to, because I think you have a global audience, but we were concerned about not having enough hospital beds, not having enough staff, not having enough supplies. So if you can get people out of the hospital sooner, that's really beneficial. And the other thing they saw is that the people that were moderate weren't progressing to severe. So everybody was getting better, with everything they were doing and vitamin C IVs. And what's notable is that they weren't the mega doses. They weren't really, really high doses. And as I've learned about vitamin C IVs and my mentors and the teachers that I've learned from, there's two categories of IV vitamin C. So what we call high dose vitamin C is anytime you're doing over, say, 12 to 15 grams. And in order to do that, you need to run what's called the G6PD deficiency test to make sure that there's not going to be any problems with that high of a dose of the vitamin C. But what they were using in China was equating to like 6 to 12 grams of C. So not even a crazy high dose of it. And there's a difference the way vitamin C works in the body when you have, say, less than 12 grams versus the high dose. So one is antioxidant, stimulating of the immune system, helps support and recycle hydrogen peroxide, which is one of the things that kills microbes and kills things in the cells. Whereas when you get into the higher doses, it's really pro-oxidant. So the pro-oxidant is when you get into like more killing of things, or what you'll see with cancer patients. And you have to make sure you balance that with other nutrients kind of in between. Does that make sense?
Interesting. So
yeah,
you just touched on an interesting point about oxygen, because I'm hearing more and more that with the current situation, it's like the cells are craving oxygen. It's like they're being deprived of oxygen in the cases of COVID. And this is potentially one reason.
Yeah, they are.
We can't talk about that particular thing, but it's anything that's going to support the immune system and oxygenating our cells ultimately is going to be good for the immune system, isn't it?
Yeah, well, I think there's oxygenation of the cells. So like bringing oxygen to our tissues is certainly important. And what you're seeing with the decreased oxygen saturation and the people that are going into respiratory failure. There's a couple thoughts on why that's happening. Like, one is certainly the pneumonia, the cytokine storms, which is like the immune overreaction that's essentially causing a lot of damage to the alveoli and the aspects of the lungs that are responsible for oxygen exchange. There's also some questions on whether the heme, which is the oxygen carrying portion of red blood cells, is being affected. And those are just big question marks. We don't really know quite yet. But what we do know is that people's oxygen saturation is getting really, really low. So people are looking at hyperbaric oxygen, some other things to support oxygenation for sure.
That's brilliant. Hyperbaric oxygen. I guess the only challenge with that is in places like England, all of these naturopathic or biohacking labs, if you like, they're closed. So in LA, we're very fortunate you're able to stay open. There's the homeopathic one in Santa Monica that's open. So if people can't get access to the hyperbaric oxygen chambers, which are phenomenal, and that's a story for another time, I think, what can people do with dosing, moderate with vitamin C and zinc and selenium and those kinds of.
Yeah, absolutely. So we're seeing, because that vitamin C dosage in those IVs wasn't crazy high, we can also extrapolate that into oral vitamin C to a certain degree. And we're seeing really, obviously some positive results with vitamin C, and it's inexpensive, it's safe. It's really hard to overdose on vitamin C, especially because you'll just, get loose stool, which is a common side effect, right? Because it pulls water into the gut. But so when you're doing it in an IV form, you're bypassing that digestive mechanism, which is one of the benefits of IVs. You're going to be able to get more into the system. Liposomal form also can get more into the system, bypassing the digestive tract. But you can use just regular old vitamin C. The caveat there is if you do tend to get kidney stones, sometimes there's issues with the citrate form of vitamin C. So maybe use a buffered form. But what I've been telling people is if they're feeling sick, you can do, basically a big loading dose of vitamin C. So there's kind of two ways to look at it. For prevention and just supporting the immune system right now, you can do anywhere for 3 to 5 grams of C, which is 3,000 to 5,000 milligrams. So it's not too much. And you want to do that in divided doses. So you don't want to do that all at once, because then you will get diarrhea. If you just take 1,000 milligrams a couple times a day, most people are good on that. And if you're sick, you can dose it higher. The body tends to absorb more C when you are sick, and you have less of those intestinal side effects, because there's something where the body just knows and it can absorb more. So there's different approaches to that, but some people will say take 1,000 milligrams or 2 bowel tolerance, and that's a good way to just get a big solid dose of it. So I think vitamin C is one of the best things we can be taking right now, all of us, preventatively, and also, supporting the immune system if you are sick.
Brilliant, brilliant. It's an oldie, but it's an effective one. It's amazing how
it's been,
it's amazing how these, they go back thousands of years, and yet they're still really effective because it comes from nature. So you've been doing, this is your practice, and this is what you've been doing since the 90s, isn't it? Late 90s. And this is how you help people with all sorts of health challenges. Do you want to speak to that at all? I've been into your lab. I love what you've got there on the Abbot Kinney, and your office there. So for anyone in LA, Dr. Cory is on the Abbot Kinney. And do you want to speak about what you do and how you help people?
Well, I do a lot of different things. So, kind of as you mentioned at the top, I've got this little health boutique, and here to support the community to stay healthy as best as I can. I do a lot of vitamin injections and vitamin IVs. I would say one of my specialties is digestive health and wellness. So, people that are having chronic digestive issues that they can't really get a handle on or aren't getting information that's helpful for them through the conventional medical system. I've been in the natural product industry for about 30 years, so I have a little I call it the apothecary. I have a lot of products and supplements and herbs and things like that. I'm also, I love homeopathy, and I know a lot of your audience in England obviously is going to be familiar with homeopathy, and there's a lot of people looking at different remedies for supporting this illness as well. So that's something that I don't know a lot of the specifics, but those are showing some promise too. I think what I've seen is that in any culture, whether we're looking at China, Korea, India, Italy, England, the US, any culture that's using some form of traditional medicine. And when I say traditional medicine, I'm not referring to conventional medicine or allopathic medicine, but some of the older ways. For me as a naturopathic doctor, a lot of what I learned came from a Western European tradition. So I do a lot with like German biotherapeutics, herbalism, homeopathy, hydrotherapy, all those old techniques, which now we're calling biohacking, but it is very old. I mean, the people have been biohacking forever. So all that stuff is really helpful. And I think across the board, when we look at people who are surviving this illness or having mild cases of it, they're all doing some, or often doing some sort of traditional therapy, whether it's Chinese medicine or Ayurveda or Western herbalism or homeopathy or diet. You know, diet is huge because we're seeing that this illness really impacts people who have metabolic disorders. So diabetes, chronic inflammatory diseases, obesity. We have a lot of that in our country. And so eating an anti-inflammatory diet or moving in that direction is definitely supportive of the body right now.
For sure. Yeah, I'm glad you support that because I've been talking about that as well because that's my subject. You touched on you touched on the cytokine storm or the cytokine storm. I heard it's the interleukin 6 cytokine, inflammatory cytokine storm. By consuming an anti-inflammatory diet, by living an anti-inflammatory life, doing things like getting grounded and being calm, all of that can really help, can't it? Bring down the inflammation in the body and support the immune system. Yeah. I was going to say, do you want to speak to that? Do you have any other awesome little strategies for people?
Well, I think what people need to realize about the cytokine storm, we're all like, ooh, cytokine storm. It's a serious thing, obviously, but it's like a major dysregulation of the immune system. And it is IL-6, but there's lots of different inflammatory cytokines. And that's their job. We don't want to turn them off. We want them to do their job. We need inflammation needs to be in balance. You can't have like no inflammation in the body because then we wouldn't survive either, because inflammation is one of the things that kills things. So we really want to have an intelligent immune system and a properly regulated immune system. So doing an anti-inflammatory diet, including things like ginger, turmeric, aromatic herbs.
I was going to say reducing gluten, dairy, and sugar. I think anyone can benefit from right now.
Sugar for sure. I mean, I think sugar just basically like paralyzes the immune system, and then the refined carbs certainly, and gluten is mostly found in refined carbs. So yeah. Garlic, onions, leeks, chives, that whole category of foods, I'm making sure to get like a big serving of those every day. Those are really beneficial for inflammation, the immune system, thinning mucus, just keeping the immune system regulated.
Brilliant.
Especially for blood type A's. Mm-hmm.
Interesting. So how do people find you? I guess you're only treating people locally, aren't you? Do you want to talk about that?
Well, I'm doing primarily telemedicine. So I'm doing a lot of COVID-19 specific consultations online. So I'm helpful to support people wherever they are. Can also, I'm doing some other things with people. I'm doing antibody testing here, but most of the work I'm doing is virtual, unless, someone's really needing to come in for a reason.
Excellent. I'll put a link to your...
I'm doing some vitamin drips and things like that too, but in keeping with all the regulations and the CDC guidelines for seeing people and all that.
Brilliant. Good for you. Thank you for your amazing work.
You're welcome, Neil. Thank you for spreading the good word. It's been really how cool seeing those stories on your page of people that have been helped from the support and the information you've been giving them. So
yeah, brilliant. I'll close it here because we're on the half hour. Thank you so much, Cory, Dr. Cory, and anyone who's listening. Anyone who's listening or watching, go and check out her website, and I'll put the link to that below. Thank you, Cory.
Yeah, so it's drcory.com and Instagram. I'm putting a lot of stuff on Instagram too. So,
are you Dr. Cory on Instagram?
Yeah, DRCORY.
Brilliant. Excellent. Thank you so much.
Bye.